How has the Trump presidency affected health inequities in America and around the world? Hi, everyone. I'm Dr. Omar Awan. I'm a physician, senior public health contributor for Forbes, and MedPage Today columnist. In just 3 weeks, the whole landscape of global health and public health has changed dramatically ever since President Trump has taken the office of presidency. And I want to discuss a few ways how there have been dramatic effects on public health and how these can perpetuate health disparities and health inequities. Let's talk first about Medicaid. Medicaid, as you know, is the largest health insurance program in America. It covers more than 70 million people. And although Trump has not threatened to cut it, in fact, he has said that he supports Medicaid, Congress, and particularly the Republicans, are trying to make spending cuts because that's Trump's agenda in terms of making America first. He wants to cut millions and billions of dollars from the American budget. And part of this is to make Medicaid more efficient. So some things that they're proposing is to put a cap on the amount of spending per enrollee in Medicaid and also make certain changes with Medicaid. So making certain work requirements for Medicaid enrollees. And that could cut millions of people from Medicaid unintentionally. And that means that people who are on Medicaid may not get certain coverage that they otherwise would get, things like, dental coverage or, mental health coverage or things like that, even vision, for example. So this can have a profound effect, and this can result in trillions of dollars cut to Medicaid. And the people that are going to suffer are those that are poor, because the people that can't afford insurance are the ones that are on Medicaid. So people who are of low income, people who are poor, people who have disabilities, even pregnant females, all these people may get sicker if these Medicaid cuts occur, and these can certainly have devastating consequences and promote health disparities and health inequities. Let's talk also about RFK. And RFK, this is Trump's nominee for the Secretary of Health and Human Services. And he's been a very controversial figure, and he may have some positive things and some negative things, but the negative aspects of him can certainly promote and amplify health disparities because he's a vaccine skeptic. He has repeatedly said that vaccines cause autism. And we, of course, know that that's not true. There's no scientific evidence to suggest that. But when he speaks like that, that results in a lot of vaccine hesitancy in America. People will start to be afraid to get vaccines. And when that happens, then rates for diseases that were thought to be eradicated will drop. Things like measles, for example, which was declared eradicated in the year 2000, start to come back, as they have already started to come back because people are afraid to get vaccinated, and then that threatens herd immunity. Herd immunity is the immunity that's conferred upon a population when a certain percentage of the population either gets vaccinated or has been previously exposed. So for measles, that should be 95%. But because we're not at that level anymore, we're starting to see hundreds of measles cases per year. And the people that are going to suffer are the ones that are underserved. Places in like rural America where patients don't have access to vaccines, so they can't be protected. People who are poor, who live below the poverty line because they can't afford insurance or they can't afford to get vaccines, and thus they get sick when these diseases come back. People like minorities, Black Americans, Hispanic Americans who disproportionately have lower vaccination rates, they're going to be unsafe and they're going to get sick. So in this way, actually, RFK can perpetuate health disparities and health inequities. Another major thing when we think more globally is the foreign aid cuts that President Trump has suggested. On day one, on January 20th, President Trump has proposed to withdraw from the World Health Organization. He's also threatened to shut down the USAID. And just from that prevents billions of dollars from going across America and into foreign countries to prevent important infectious diseases like HIV, TB, and malaria. And although Secretary of State Rubio has said that, there will be a waiver and life-threatening and life-saving, medications and life-saving services will still be provided, it's a little unclear what that exactly means because there are still HIV clinics that have shut down in South Africa. There's still a lot of malaria clinics that aren't getting aid in Africa. Even certain vaccination programs in Africa have been shut down. So although there is a ton of aid that's going in still, there's still a lot of uncertainty about what aid is actually going to be realized to the people. And every day that there's no aid coming in, for example, if you look at Malaria No More has said more than 1,000 people die every day when no aid from the United States comes. And that's a huge number. And these are all preventable deaths. And these are all particularly in poor areas and children. Children are dying and poor people are dying because they're not getting this aid. this will certainly perpetuate health disparities. The final thing I want to talk about is PEPFAR, the Presidential Emergency Plan for AIDS Relief. This was started in 2003 by President Bush. It's saved more than 26 million lives since 2003, and it has prevented more than 5.5 million babies from getting HIV from their mothers. And even though there's been a limited waiver now where, the president has said, that they can still get aid and certain aid will still be given, like HIV medications, HIV testing, counseling, that's life-saving. There's certain parts of PEPFAR that aren't under the waiver. So things like cervical cancer screening or pre-exposure prophylaxis to people that aren't pregnant females, or even vulnerable children, they're not part of this aid. So you can imagine this is going to affect millions of people in Africa, and this is going to allow HIV to spread, and diseases don't have borders. It can spread not only in Africa, but also in Europe, in Asia, and even in America because of the ease of international travel. So this also will have devastating consequences, and the people that will suffer the most are those that are poor, those that can't afford medications, those that can't afford HIV counseling and things like that to prevent these serious infections that can go on and change people's lives. So just these consequences, although we don't think about them, they're all around the world, and these things have consequences. All the actions the president does, that Congress does, has important consequences for public health and global health. And I hope that you realize that and hope you understand that. Hope that was helpful. Thank you so much for tuning in. Please subscribe to the MedEd page. And as always, please be kind to yourself and to those around you.